On Saturday, the federal government began the unwinding process for Medicaid. What does that mean? Well, specifically, the pandemic era protections on Medicaid recipients, known as continuous coverage mandates, which were put into place to help the vulnerable maintain insurance amid the pandemic, the crisis, which resulted in record high Medicaid enrollment. Well, that is going to go away. That is going to be unwound, taken away. And so it's going to have a massive effect on a lot of people. And look, just like pretty much the rest of all the pandemic measures that have helped millions of Americans be able to get through a very difficult time, this is gone. At the end of last year, congressional negotiators agreed, on a bipartisan basis, by the way, to set April 1st as the beginning of the unwinding process for the continuous coverage mandates, which prevented states from conducting regular eligibility screenings for Medicaid recipients. So it basically temporarily did away with a lot of the means-tested programs, or in this program. Now, on Friday, Joan Alker, executive director of the Georgetown Center for Children and Families, tweeted that tonight at midnight, some people in Arizona, Arkansas, Idaho, New Hampshire, and South Dakota will lose their Medicaid coverage. South Dakota is especially vexing, as expansion actually kicks in July 1st. So, look, South Dakota finally took the Medicaid expansion that was offered to all the states under the ACA. That starts July 1st, but now, as of April 1st, you're SOL. You needed Medicaid, you're out of luck, man. Now, furthermore, Alker added that the state could structure their renewals to ensure that parents move seamlessly into expansion, but are erroneously claiming that federal rules mean that they can't, which is not true. Now, the total impact is estimated to be up to 15 million Americans who benefited from the relaxed eligibility rules. They are going to, a majority of them are likely to lose their health care. And around half of them actually would still be eligible. I'll get to that point. Now, unsurprisingly, the residents of 10 states that have refused the ACA's Medicaid expansion are likely to get hit the hardest by the end of the continuous coverage requirements, which includes children. So it's amazing. We've had the ACA for a very, very long time. And you had red states still that are like, no, we're just not going to do it. Well, why aren't you going to do it? We just don't want to. F the poor. Look, guys, the cruelty is the point. Okay? Maybe it's just they wanted to reject anything that was offered by the Democrats, specifically Obama. Even the Medicaid expansion that would help so many of their underserved, underprivileged people that are in these states access life-saving medical care. They said, no. If it's going to help a poor person, we do not give a damn. That's who they are. Now, the other thing is, millions of children are going to be affected by this. Wait, Republicans, do you not care about children? You say you care about children. You say you want to protect children. You say you want to help kids, but you don't want to help them get health care. That's rather strange. Now, the Washington Post's Amy Goldstein also reported earlier this week that because those states tend to make only the extremely poor eligible for Medicaid, they will have many people who make too much to qualify for government health insurance, but not enough to reach the income needed to get federal subsidies to afford health plans sold on ACA marketplaces, which is the coverage the administration counted on as the main fallback for these people. So they're essentially stuck in the middle. They're too rich for Medicaid, right? Too poor to afford the marketplace and to get subsidies. And so what happens? Well, they're screwed. Basically, a bipartisan group of Congress people said, go ahead and die because we're not going to help you. We care too much about the profitability of health insurance companies. That's all we care about. Now, Goldstein added that the toll will be large. In 13 states that have not chosen to extend Medicaid benefits to women for a full year after they give birth, Texas falls on both of those lists. Texas also has a pretty restrictive abortion ban. And so, Texas, yes, everything is indeed bigger in that state, including the giant middle finger they're giving to poor people and women. So, keep it classy, Texas. And as Jake Johnson of Common Dreams explains, because of the administrative barriers associated with income verification and other eligibility tests, many people are likely to lose Medicaid even though they're still technically eligible for the program. How many? Again, I mentioned nearly half. HHS has estimated that nearly 7 million people could be removed from Medicaid despite being eligible due to administrative churn. In a recent report, they wrote, people who experience churning or coverage disruptions are more likely to delay care, receive less preventative care, refill prescriptions less often, and have more emergency department visits. In fact, one study found that unstable Medicaid coverage increased emergency department use, office visits, and hospitalizations between 10 and 36%, and decreased use of prescription medications by nearly 20%. Compared to individuals with consistent Medicaid coverage. So the more you're disrupted by these ridiculous means tests, the worse off your health outcomes happen to be. Oh, children with interruptions in coverage are also more likely to have delayed care, unmet medical needs, and unfilled prescriptions. So, that whole caring about the children thing, not if it costs rich people money. Now, there are some people undoubtedly thinking, look, man, poor people on Medicaid, how does that affect me? I don't want to pay for poor people. Well, turns out you do. You see, when poor people go to the ER and they cannot afford it, hospitals end up recouping the charges by charging insurance companies more money. Insurance companies then do not eat the costs. They pass the costs on to you by raising premiums. So, yes, it affects you. And yes, it actually does cost you more than what you would actually pay in taxes in Medicaid to have them covered. Now, of course, if you don't actually care about that too, and you just hate the idea of poor people getting health care, well, I mean, can't really do anything for you. But maybe this would be a good argument. You're paying so much more than anyone in the world for healthcare that is not universal. So you could be covered and pay less and actually nothing out of pocket under a Medicare for All system. That's what we're trying to fight for. There's a reason Medicare is extremely popular, and there's a reason that, again, a majority of Americans like the idea of expanding Medicare to everyone. And why insurance companies hate it. Now, there's those sides, but there's also people who work in the medical field who are very interested in moving us towards a Medicare for All system. I talked about the National Nurses United Union before, but here's one ICU doctor at Cambridge Health Alliance named Adam Gaffney. Here's his quote on this. I feel sick. Some 15 million will be purged from Medicaid, including 7 million who actually remain eligible for the program but fail to jump through the bureaucratic hoops. Hey, if you hate bureaucracy, if you're a right-winger, I hate bureaucracy too. Just expand Medicare to everybody. He also says that Medicaid is not enough. We need seamless, lifelong, universal care now. Medicare for all. Look, it's not only free for average people, working people, right? For everybody, because everybody gets it. But at the end of the day, it's also cheaper for the government and the taxpayer in the long run. And you might think, why? How is that possible? Well, it's because we would not be in a for-profit system. In the for-profit system that we have now, remember, there's a profit motive that is basically meant to add costs that executives can extract in order to make quarterly profits and make more money for themselves, their executives, the board of shareholders, stockholders, all these different overhead costs that could be eliminated if there was no profit motive in health insurance. If we eliminate that, we eliminate that profit motive in the administration of health insurance, well, that's going to bring down the costs. That's going to put the money that used to go to bonuses, executive compensation, stock buybacks towards your healthcare, which is what it should be going to anyway in the first place. And the government would also, since it would be empowered as the United States, the country's insurer, would be able to negotiate with hospitals and drug makers in order to lower their prices, lower costs, because they certainly can. And not only that, but again, there are some doctors that are concerned that, well, okay, but if you have a Medicare for All, then, well, we wouldn't be able to stay in practice. We wouldn't be able to make enough from reimbursement under a Medicare for All system. We'd have to close up shop. No, for one, you wouldn't have to have a separate billing department set up to, make sure that to go through insurance claims and haggle with insurance companies. You can get rid of that department and focus solely on being able to treat patients. And plus, the government, it's not like they wouldn't negotiate a fair market rate for you to be able to still stay in business and see patients, because what we need are doctors. And in other countries that have universal healthcare, single payer systems, it's not like they don't have doctors. They still do, and they get by just fine. And so do the people who live there. They end up having better health outcomes and a higher life expectancy than we do in the United States. So there's so many different reasons why we should go to universal healthcare instead of doing what we're doing now, which is to say what we're doing to Medicaid by limiting eligibility and pulling back on pandemic era programs, which are actually great models to show that the government can administrate these programs and do better for the average citizen. Instead, we're unfortunately going backwards. Now, speaking of going backwards, of course, this isn't the only pandemic era protection that is coming to an end. You have March 1st that had enhanced SNAP benefits that were cut off in dozens of states. So now you have food aid that has been slashed for tens of millions of people. The child tax credit, of course, it expired all the way back in 2021, thanks to Joe frickin' Manchin, congressional Republicans, that has increased child poverty. And not only that, but boosted unemployment benefits were also ended at a time that we're now seeing, of course, Jerome Powell in the Federal Reserve raising interest rates with the goal of creating more unemployment. And that's all while people are still reeling from the pandemic, dealing with the aftermath of the shutdowns. And of course, you have greed that has driven inflation. And so even with that, though, even with everything that's going on, you can see that mainly congressional Republicans, with their Democratic allies, have been looking to roll back these programs, Medicaid, SNAP, and other key programs, even further, using the national debt to justify screwing poor people. Instead of course, cutting things like, the hundreds of billions of dollars that we send to the military-industrial complex that does not go to pay for the troops, that goes to defense contractors. It goes into their pockets for weapons that are used against, take your pick, right? Where we're doing these, strikes, whether we were supplying the Saudis with weapons in order to, murder people in Yemen, or the oil subsidies. That's another thing. that we send so much of our budget for, we're spending it on giving really, really rich oil companies who are already gouging us even more money. It's insanity. But at the end of the day, that insanity makes a lot of sense to certain people, especially ones who believe that cutting off the poor, well, for them, the cruelty is the point. And that's exactly what they're trying to do, is to be as cruel as possible while giving as much as possible to their wealthy donors.